Hi everyone, in this video we will focus on depression in children and adolescents. We will talk about what depression is, how it presents differently in teens and children, and the different ways teachers can intervene in a classroom setting. Depression is actually an umbrella term for all types of depressive disorders, but in this video we will be focusing on major depressive disorders. Major depression is an episodic, recurrent disorder characterized by persistent and pervasive sadness or unhappiness, loss of enjoyment of everyday activities, and irritability. Manifestations of depression can occur depending on different risk factors. It can be biological, like family history or predisposition to certain mental illnesses and disorders. It can be genetic or simply due to puberty and hormonal changes. It can also be psychological, like past trauma or personal history of other mental illnesses and disorders, since there is a high chance of comorbidity, meaning having two or more illnesses at the same time. Or it can also be the environment, like family abuse or neglect or bullying. Did you know that depression tends to affect more teen girls than teen boys? The ratio of depression in males and females is similar in prepubertal children, but becomes about twice as common among females during adolescence in comparison to males.
Depressed patients can display symptoms at any age. However, the symptoms can vary according to the developmental stage, resulting in differences in the way depression manifests itself in patients. Now, which are the most common signals presented in a classroom setting? We can notice a depressed student if it shows lack of interest, a decrease in the student's performance, class skipping, and self-isolation. Now let's see the symptoms in children. Irritability, reactive behavior, and somatic complaints. These symptoms are frequently related to anxiety, behavior issues, and ADHD. Now let's take a look at the presentation in adolescents. Here we have all the previous symptoms plus hypersomnia, increased appetite and weight gain, extreme sensitivity to rejection, and difficulty maintaining relationships. But as educators, how can we help? What should we do? Which are some classroom interventions that can be introduced? In a classroom setting, we can help a depressed student if we develop a collaborative relationship with the student, talking about how they feel and not giving up on them, which is key for the student's motivation. We avoid negative techniques such as punishment, sarcasm, and disparagement. We make adjustments in tasks and plans, for example, extending the deadlines, dividing assignments, and offering extra help.
We have compiled a list of extra resources in case you want to read further. For more information on how to help students with depression, you can visit any of the websites on screen. Thanks for watching.